Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be speaking with our wonderful chiropractors and specifically talking to them about their treatment technique of choice. Within the clinic, we practice the most common form of chiropractic adjusting techniques called diversified adjusting. But you may not know that the chiropractic profession has over 200 adjustive techniques. We also specialize in a very specific type of chiropractic adjustment called Cox Decompression. This technique is wonderful for patients that can't tolerate a regular spinal adjustment or that have a contraindication. Sometimes patients with disc injuries will respond much better to this low force decompressive type of treatment. So without further ado, let's talk with the doctors and let's see what this specific adjustive technique can do for you. Take it away, guys.
Hi, Dr. Dave here. I'm with Dr. Brooks. And we're here to go through with you. This is the Cox Table. We wanted to introduce it to you. There are many different ways to adjust the traditional method by hand, but this gives an alternative. And you want to give some examples of when we might use it?
Yeah, sure, especially if somebody comes in and they're really acute and really flared up or, just in a lot of pain and we can't really do our normal chiropractic adjustments. This helps just give some range for us to decompress the spine and give the nerves a bit more space and help the discs kind of regain some of their fluid if they've been compressed for a long time. So there's quite a few different uses. A lot of people actually prefer it to standard chiropractic adjustments, especially if there's a lot of kind of neurological nerve stuff going on as well. It's really helpful to minimize any damage that could occur.
Yeah, it's actually designed for disc injury, so it's really a perfect match for a lot of people. Sometimes people come in, they're just nervous, and it's a nice way to start. It's gentle, low force, and it puts people's mind at ease, and we can always transition to different techniques later on.
Absolutely, yeah, it's definitely a good intro to chiropractic,
Yeah, and not many offices have this, so we're lucky to have it here at Maragal Medical.
Definitely.
Should we demonstrate?
Sure, let's go for it then.
Okay, I'll be patient. I need some help anyway, Dr. Brooks.
What's going on then? What can we do
Low
here?
back, Cox, please.
All right, let's get it.
Okay.
All right. So there is the option of these ankle straps here. I'm going to use them on Dave since he's, a veteran here. So this just adds a little bit of extra pulling capability for the table here. They're not completely necessary, so if somebody's like really sore, we probably wouldn't use them. And usually there's a little bit of pressure just with the opposing hand here on some of the spinal segments, which helps just be a little bit more specific in here. And if we turn the bench on here, pull that down a little bit. So I like to start with the lowest segment here, so I'll just put a bit of pressure on the lowest segment. And there's an option for manual and automatic movement there. So let me start that over. So when I release it can come back there. And I'll just move my hand up in increments here along the spine, putting little bits of pressure and traction in between each segment there. That feels all right, Dave?
Feels great.
Good. And if that's tolerable, that was okay all the way up there?
Oh, yeah.
So then we can add a little bit more each time. And just get a little bit more traction with each repetition there. And then we can come back down again towards the base of the lower spine there. Just always checking that it's comfortable as well. Still feels okay there?
Oh, yeah, definitely.
Not too much pressure?
Not very comfortable.
Good, good. Alright. And then we we can just let that kind of come all the way back in, and that's that. There's also part of this table here has a segment that detaches like this and like this. So if we can get a bit more specificity from right to left here, so we can do a little bit of traction and movement side to side, and this just helps some of the what's called facet joints on the outsides of the spine get a little bit of traction and movement as well. And you can come around in little circles, and you can even add a bit of that manual bench traction as well. Get a little bit different angles, and it's just a really nice way of getting some motion into these segments that normally people wouldn't have access to, especially if they've been, you know, disabled or, you know, immobile for an extended period of time after an injury or whatever else. And that feels all right there still?
Oh yeah, really good.
All right. And let that come back in. And then we lock that back in, lock that in. That's done. And that's that. Doing all right? Coming on up?
Very comfortable.
How you feeling there?
Feels good.
Yeah?
I think I'm ready.
Bit taller?
Yeah, am I taller? I feel like about an inch and a half taller. I need to do this more often.
I know. Yeah, definitely.
Awesome.
Cool. Yeah, well that's it. And that's, you know, simplistic but very effective.
Yeah, just one more tool we have here at Maragal Medical.
Absolutely.
Wasn't that great information? Oftentimes it can be scary when you go to the chiropractor for the first time because you think it's going to be painful. But I think it's really clear, and I think you all understand now, that there are many options when it comes to the type of technique a chiropractor uses, and Cox Decompression is one of the most heavily researched chiropractic techniques out there. Our clinic is unique. We're a full-service physical medicine clinic, and under the leadership of our medical director, Dr. Michael Marciello, we incorporate medical care, chiropractic treatment, physical therapy, and have a special interest in regenerative medicine and integrated nutrition to make sure each and every patient gets the best treatment options possible. And we take most insurances. If you like the information you saw today, please subscribe to our YouTube channel. More information can be found on our practice on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let Maragal Medical guide you in the right direction to health and wellness. That's it for today. I hope you enjoy the rest of your week. Have a great day, everyone.